You've likely heard the term chronic pain. The National Institute of Neurological Disorders and Stroke says the source of that persistent pain can include a serious infection, maybe even a sprained back.
But some people suffer from it for no apparent reason. Common chronic pain complaints include constant headaches, arthritis, nerve, and low back pain. The National Institutes of Health finds an estimated 11.2% or more than 25 million Americans experience chronic pain, which is described as pain every day for at least 3 months. Opioids, which are pain-relieving drugs, can be effective for treating pain if a patient follows a doctor's orders. Opioids help dull a person's pain and boost feelings of pleasure.
They can also become dangerous because the feeling of pleasure from taking them can lead to addiction and, in some cases, death. According to preliminary data this month from the Iowa Department of Public Health's Bureau of Substance Abuse, there was a 35% increase in opioid overdose deaths in 2020 when compared to 2019. Early data shows there were 212 opioid overdose deaths in Iowa in 2020. In Nebraska, the Department of Health and Human Services says in 2018, 154 people statewide died of a drug overdose. At least 60 of those deaths involved opioids. The National Institutes of Health indicates in South Dakota, half of all drug overdose deaths involved opioids in 2018. That's a total of 28 people statewide.
We recently spoke with Dr. Jeremy Polson, a local board-certified anesthesiologist and pain specialist, about chronic pain, opioids, and alternative treatments. Here's that conversation. Can you elaborate? First of all, what's chronic pain, and when are opioids the best course of action?
So chronic pain is defined as a pain situation that lasts anywhere from 3 months to years. But typically, if you experience pain longer than 3 months, that is chronic pain.
And what is the best course of action to take? Is it sometimes opioids?
So obviously, opioids have been an issue in our society for a while, most notably over the past couple of years where it's really been publicized. I think it's important to understand the difference between addiction and misuse. When someone misuses an opioid, it can be simply taking it a little bit more too frequently than it's prescribed. Abuse is when, or addiction is when someone takes a medication to the extent that they are willing to put their own goodwill and the goodwill of those around them in jeopardy.
So those obviously are the warning signs that a patient might be developing an addiction to the opioids. What options does a patient have other than opioids?
So fortunately, there are a myriad of other medications that we can use when dealing with people with chronic pain. Obviously, one size does not fit all, and every person is unique in their ability to, whether they can handle certain medication and whatnot. So we try to tailor medication management for our chronic pain patients. Additionally, we have interventional pain treatment options, whether those are injections, whether they're implantable devices, surgical techniques. The one fortunate outcome from all of this opioid craziness has given us an opportunity to take a step back and really dig into our tool chest and add some more tools to that tool chest and add some arrows to our quiver to really attack the issue that many people suffer from, as you alluded to. A lot of people are suffering from chronic pain.
And obviously, these alternatives, as you're finding with your colleagues, can be effective in managing the pain.
Oh, certainly. And fortunately, we are able to rely on these different measures to kind of attack the pain source from different angles. It's, the advent of medical marijuana, if you will, and THC, CBD. Some of these other options have really been brought to the forefront. And I think it's important that we understand that not every treatment option is going to fit every person. We need to be careful with what we encourage and that we tailor those treatment options for everyone. But there are definitely options out there for people that who have chronic pain and who suffer from chronic pain that will help them live a better quality of life.
As you heard Dr. Polson mention, treating chronic pain is not a quick fix. It requires working closely with your doctor to find the best option for attacking that pain. Some people also turn to methods such as acupuncture, ice and heat application, massage, and other